Today I want to get into a few important details of the new federal recommendation from our lovely health leaders in regards to taking a third mRNA shot, Moderna or Pfizer, not Johnson & Johnson. They're kind of like the runt of the litter where it's like, oh, we don't have enough data on Johnson & Johnson yet, so just focus on your mRNA, because Johnson & Johnson is not mRNA. Anyway, Surgeon General said this.
Today, we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older.
Interestingly, he's specifically saying a third shot is not recommended for children, okay? But they did set the magic date for getting that third shot to 8 months out.
They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines.
Also, interestingly, today the CDC put out a whole webinar on getting your VAERS report filed. This is very interesting.
And we also ask that you continue to report clinically important adverse events to VAERS. We really do value healthcare provider reports to VAERS.
They specifically called out children.
Use of the Pfizer-BioNTech COVID-19 vaccine in adolescents aged 12 to 15 years. There is the capability in one of our systems, which I'll get into later, called vSafe, that allows parents to register children.
It makes me wonder if they're becoming aware of more cases. I know I just interviewed a dad who lost his 16-year-old son after the shot. I'm working on editing that story now. He never filed a VAERS report. So I'm just wondering if the CDC is having its own concerns about people having adverse events and not getting them filed. So CDC made a push to file your VAERS report and also sign up for vSafe. Now, why on earth the news didn't talk about vSafe sooner is really fascinating to me. But yeah, if you get the shot, sign up for vSafe. That sounds like a great idea.
And that includes participating in vSafe as a patient when you get vaccinated. And the 15-minute waiting period after vaccination is a great time for patients to enroll.
So CDC Director Rochelle Walensky got into some of the details of the declining or waning effectiveness of the COVID-19 vaccines, citing several studies.
Like we saw in the New York data, vaccine effectiveness against infection declined over time.
Now, she briefly mentioned Israel.
Additionally, reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early.
The Israeli data on COVID-19 breakthrough cases is pretty stunning. Now, this looks at, this is a big breakdown, but the summary down here is what's really eye-opening. Is Israel confirmed cases July 4th through the 31st. So out of a sum total of 18,000 plus people right here who caught COVID, the fully vaccinated and the unvaccinated, 85% of the people with COVID had been vaccinated. So 85% of COVID cases were breakthrough cases. Also, about 85% of the population was fully vaccinated. So this right here tells me that about the same percentage of people with the vaccine are getting COVID as the people who haven't got the vaccine. So basically a total lack of effectiveness with the vaccine in Israel in the month of July, according to this chart, which cites the source right down here. So I wanted to go to the source, which is the data dashboard from the government website in Israel. So let's look at that. So here we have the raw data from the Israeli government health website, and it's written in Hebrew. I had to translate some of it, but here's the key stuff here. Breakdown by age right here, and the week that the person got the shot. Let's expand that. So it's a finicky website. You have to, if you accidentally click something, it'll resort. But here we have it. The first shots of COVID-19 vaccine, like elsewhere in the world, were given out in December of 2020. And these are the positivity rates immediately after vaccination. You know, some people were having breakthrough cases right here. We're not even going to look at that because these people hadn't been fully vaccinated yet. The most important two rows to look at actually are these. These are people who've caught COVID who have not been vaccinated here. It says some positive without vaccination, and then this chart right here, positive above 20 days after second dose. So nobody had had their second dose yet at this point in December, so obviously that chart is bare. Now we're getting into January here, and more people are getting vaccinated. Most people are still not fully vaccinated. Israel had done a big push for vaccines and really got a large number of their nation vaccinated compared to other countries. So people like to look at Israel because not a lot of countries are as vaccinated as Israel. So you can see the further down you go, the more breakthrough cases further out there are. And then this last chart again is the unvaccinated people. Okay, so let's see if we can go all the way to the end. So here we're in May. Oh, here's August. So let's go back to July. Scroll down to July. And so again, here at the end is the some positive without vaccination, and then the positive above 20 days after the second dose. And you can see how it's changed. You know, now it's all vaccinated people catching COVID, and the unvaccinated have a lot less COVID cases. But it's interesting, we do see these big numbers. Those are the kids, age 0 to 19. And the previous chart I showed you actually omits the children age category. So a lot of unvaccinated kids are catching COVID according to Israeli data compared to older people. Actually, the oldest in their communities have the lowest unvaccinated COVID-19 rate. Actually, whether vaccinated or unvaccinated, lowest rate. But you can see how it changed, and now it's mainly vaccinated people catching COVID according to the raw data out of Israel. Very interesting. The CDC director got into a few studies of the vaccine's effectiveness over time and how that effectiveness is waning. More and more breakthrough cases are happening. She mentioned some Mayo Clinic data, that line at the bottom that shows the Pfizer vaccine had declined to only 42% effectiveness.
The data consistently demonstrate a reduction of vaccine effectiveness against infection over time.
See how she emphasizes the word infection, decline in effectiveness against infection. But when it comes to hospitalization and death, she's really pushing that it is still effective.
Vaccine effectiveness against hospitalization remained high. However, in this study, only about 7% of samples sequenced for the Delta variant.
So it was May 1st that the CDC announced they are no longer going to be transparent about the total number of breakthrough COVID-19 cases. They're going to shift their attention to hospitalizations and deaths, but without knowing the total number of breakthrough cases of COVID-19, it is hard now to do a comparison of the death rate of people who are vaccinated who catch COVID-19 versus people who are not vaccinated who catch COVID-19. Now, back in May, shortly after the CDC cut off part of its data, I interviewed the Houston Health Authority, Dr. David Pearce, who is in lockstep with people like the CDC, and it was very interesting. I brought this topic up to him. At that point, I did still have fresh data on the comparison of COVID-19 related deaths amongst the vaccinated versus the unvaccinated, and he agreed with me at the time.
Looking at the CDC's numbers on breakthrough deaths, 2% death rate amongst people who caught COVID after vaccination. that is about the same death rate for people who did not get vaccinated than caught COVID. And so so basically, I mean, if you do catch COVID after vaccination, you have the same chance of dying.
So what I'm seeing, and this is purely just my observation, I've got no data, but what I'm hearing from my colleagues in the hospitals appears that if you are vaccinated and then you contract COVID and you get sick enough that you wind up in the hospital, that it's your chances are the same, because they're about the same. That's what I'm hearing from my friends that are working in the hospitals. It appears that once they get hospitalized, their course of the illness seems to run similar to as if they had not been.
Well, now the CDC's narrative is that, yeah, you do have a bigger and bigger chance of catching COVID, even with the vaccine, but if you get it, at least you won't have as severe of symptoms. It's very contrary to what we were looking at when we had the full data on breakthrough cases. Now we kind of have to take the CDC's word for it. I actually looked up the New York study that Rochelle Walensky cited, and it is very interesting to me because they got into the numbers with the breakthrough cases in New York and the hospitalizations, but it was really interesting in their final little write-up towards the bottom, what it says right here. Finally, data were too sparse to reliably estimate vaccine effectiveness for COVID-19 related deaths. So there's no transparency on whether the vaccine actually is more effective at saving your life than if you didn't have the vaccine. Maybe there is good data out there and I'm not seeing it. If so, send me an email or a comment. My email is ivory@ivoryhecker.com. Now, I did just interview Dr. Joseph Verone, the Chief of Staff at United Memorial Medical Center, who he keeps it pretty real, and he did tell me that the majority of his COVID patients who end up hospitalized are unvaccinated.
I'll tell you, in the hospital, 95% of the patients that I have in a hospital are unvaccinated.
Anyway, the Moderna and Pfizer shots are going to be administered in their third dose beginning next month. Not Johnson & Johnson though, mRNA only. So let me know what you think of all of this. Email me, ivory@ivoryhecker.com, or write a comment, and I'll get my audio situated. I know I'm having some audio issues, and I'm moving right now. I'm getting my home studio set all ready to go so I can really knock out some serious content every day. There is so much to cover right now, and it's really important to cut through the narrative at this time. Send me your story ideas, and I'll talk to you soon.